Hello, my name is Lawrence Pascual, and I am a MSN CNL student at Toro University, and I will be presenting my capstone project, which is improving patient outcomes with bedside reporting. So this presentation examines the planned implementation of bedside reporting at the Medical Oncology Unit at Santa Clara Valley Medical Center. So the unit is a 36-bed unit with varying patient diagnoses such as cancer, heart disease, liver disease, HIV, and end-stage renal disease. So chemotherapy, telemetry, peritoneal dialysis, and end-of-life care are just a few of the skills that are being done in the unit. And Santa Clara Valley Medical is the public hospital of Santa Clara County, so the patient population is very diverse in culture and also financial obligations. So the bedside reporting project results from the clinical microsystem assessment that I conducted last month in the unit, and also from the feedback from the nurse manager from the nurse leader interview assignment. So with the CMA, I actually looked in particular at the change of shift process, and I found that there's no policy or clear guidelines. So the current practice at this time is that the nurses obtain a report in front of the computers in the nursing stations without patient involvement. So there's strong correlation between bedside reporting and two particular outcomes that I looked at in the unit. First is the high number of falls, especially close or during shift change. So as you can see in the first graph, the unit has high number of falls, and most of the falls happen during or close to shift change when nurses at the nursing station. So this graph is from November of last year to the April of this year. So secondly, patient satisfaction is not satisfactory. The second graph is the HCAP scores of nursing during the clinical microsystem assessment in April. It hovers around 80%, and it's really not up to benchmark. So the nurse manager's goal is to have that number closer to 90%. So the hope is that bedside reporting implementation will help alleviate both of these challenges in the unit. And the short-term goal of this project is to implement a standardized bedside reporting to improve the two patient outcome mentioned. The long-term goal is to cement the process into the policy. So why is bedside reporting important? So bedside reporting has many advantages. So first, bedside reporting is patient-centered. It allows the patient to be an active participant in their care. So this gives patient opportunity to clarify, add information, and ask questions. So with bedside reporting, nurses and patients can also plan mutual goals, so not just the nursing goals. So this in turn makes patients more accountable and more compliant, and basically, hopefully, they're more satisfied with their care and they will have better outcomes. So bedside reporting is also safe care. Having nurses at the bedside allows them to visualize the patient and correct any mistakes at the start of the shift. And since nurses are with the patient during the report, they can readily attend to patient needs, including their ADLs, which is the main reason for patient getting out of bed and falling. So improved patient outcomes with bedside reporting, such as falls, also saves the hospital financially. Improve outcomes and patient satisfaction not also decreases length of stay, but it also is the basis for reimbursement, especially from the CMS. So bedside reporting is also in line with the triple aim of healthcare, which are as follows: to improve patient experience, improve the health of population, and to decrease costs. It is also a Joint Commission recommendation, and National Patient Safety Goal supports bedside reporting as well. And finally, it is evidence-based and it is supported by research. So here are just a few examples of studies supporting bedside reporting. So the Beginning in Korea study, it's a qualitative study in the pediatric unit which explored nurses and patients' perception of bedside report. So the study found that for both nurses and patients, bedside reporting is the most preferred method of shift report. Nurses perceived barriers, but overall nurses thought that bedside report positively impacted patient care. And they were able to do quick assessment and identified some safety concerns such as missing equipment, missing orders, or inaccurate IV fluids. Patients, on the other hand, perceive the process as being more thorough and transparent. Patients also stated that with bedside reporting, they were able to clarify or correct information. The San Jacqueline and Sherman study is a quantitative quasi-experimental study on all the med-surg units in a hospital in West Virginia. Again, it is consistent with other studies involving bedside reporting in that the perception of communication and patient involvement is greater. In addition, medication errors and falls were reduced during shift change. The outcome of the Mangino and Anderson study is increased patient satisfaction with bedside reporting implementation. So staff satisfaction also improved in areas such as accountability, interpersonal relationships, and receiving pertinent information. Nurses were able to prioritize their tasks because they were able to see their patients at the start of shift. Overtime is also decreased because bedside reporting takes less time, which saved the organization financially. So based on the CMA and with the literature review, I developed my PICO question. So for medical oncology nurses, does the use of standardized bedside reporting compared to traditional reporting improve patient satisfaction and decrease patient falls within a 3-month period? So in this project, bedside reporting refers to the concept of giving report to the incoming nurse in the presence of the patient at the bedside. So traditional reporting is the current practice of giving report at the nurse's station without patient participation. Patient satisfaction will be measured from the HCAP survey with 3 questions dealing with nurses' communication. So the first one would be, how often did the nurse treat you with courtesy and respect? And second one, how often did the nurse listen carefully to you? And the third one would be, how often did the nurse explain things in a way that you could understand? And this will be measured monthly. So patient falls that will be included will be the incidence of falls during or close to shift change, and this data will be obtained from the incident reports from the hospital and the fall committee. So the bedside reporting project will be based on the Kurt-Lewin's change theory. The unfreezing stage will be the pre-implementation stage. This will be an opportunity to form a team and obtain support from the management. And if all goes well, my team and I will present the plan to the executive management and also the nurse managers on May 24th. And depending on that presentation, the project will then introduce the innovation in the med-surg competency class in June, where we will educate and get feedback from the staff. So we will then implement the project in the unit where we will offer support and address any difficulties that may arise. We know that teamwork will be important. And we'll plan to use the PDSA cycles as well to test the change and make adjustments as necessary. So the refreezing stage is where we can cement the practice into the daily routine, and this involves frequent education and engaging staff by celebrating successes and providing positive reinforcement. And hopefully the executive team will set the practice in the hospital policy. So there are some ethical concepts that need to be addressed with this project. First, with the principle of autonomy, study participants need to be well informed of the project and that they are willing to participate in their own accord without coercion. Secondly, with the principle of veracity, the content of the project, including the data and the results, should be accurate and truthful. So the conductor of the project should also be honest when conveying information to participants. Finally, with privacy and confidentiality, since we are dealing with patients' medical record, utmost care of sensitive data must be high priority and HIPAA guidelines must be followed. So in summary, bedside reporting is slowly becoming the standard practice of change of shift reporting. Several studies supports the benefits and is backed by accrediting agencies such as the Joint Commission and Agency for Healthcare Research and Quality. Therefore, it is imperative that organizations must adopt the practice. Fortunately for Santa Clara Valley Medical Center and the Medical Oncology Unit, there is a hunger for change. Frontline staff and the management team are warming up to the idea of bedside reporting, and I think that after implementation, they will not be disappointed. So here are the list of my references, and thank you for listening, and thank you.